start, please take a look at the instructions in the chat area and make sure that you have the handout and the quiz link. You'll see those both in the green box in the chat area. You'll also see some files in the shared file folder as well. So again, welcome everyone. Thanks for being here this evening. Large class tonight. And let me go ahead and bring up the presentation. You'll have a copy of this presentation in the course folder. And I'm going to review how to receive CE credit and then introduce you to our speaker this evening. So in your course folder is a copy of this document, How to Receive CE Credit. There is a link there. The link is also in the chat area, or you can go to our website, dentalceacademy.com, tap on quiz and navigation or /quiz. I recommend that you complete the quiz this evening. We will give you a passcode at the end. Enter that passcode in the chat area. Enter the passcode in the quiz that you'll find in the chat area. Now, you'll have 7 days to complete the quiz, but I recommend just getting it done this evening. At the end of this course folder here and the document, you'll see the ability to request assistance. All right, so there's the link for you. Now, again, you do have a copy of this presentation in your course folder. If anybody needs it, let us know. So at the end of the presentation, we're going to have Dr. Saini be available for Q&A. So you can post your questions in the chat area for Dr. Saini as well. We do want to thank H2 Ocean for their generosity in supporting this course this evening. Following the presentation, stay on for a few minutes. You'll hear from Eddie Colos with H2 Ocean to talk to you about their products and how you can obtain free samples as well. Any questions about how to receive CE credit this evening? All right, let me go ahead then and introduce you to our guest speaker this evening, Dr. Rajiv Saini, periodontist research author. He's a Harvard Medical School graduate specializing in clinical operations with a concentration in industry leadership. A dentist and periodontist by training, he is recognized for his expertise in oral systemic health research. His work primarily examines the host inflammatory and immune responses to periodontal infections, establishing periodontitis as a significant risk factor for various systemic diseases. Experienced in implementing scientific strategies in a variety of R&D operations with his major focus on projecting research value propositions and mapping new avenues for scientific growth and innovation. His scientific portfolio includes more than 170 peer-reviewed publications in high-impact journals, 5 books, 3 book chapters, and multiple patents. His globally recognized scientific contributions and numerous research awards highlight his pioneering role in scientific advancement. So welcome, Dr. Saini. Thank you so much for being here. And again, please post any questions you have in the chat area. Thank you.
Good evening, everyone, and thank you for joining today's session. This course focuses on oral HPV from a practical chairside dental perspective view rather than an oncology lecture. We will review why HPV matters in dentistry and how we as the dental professionals contribute to early detection and prevention of oral HPV. Today's educational course has following learning objectives. We will define the clinical characteristics and transmission pathways of oral HPV relevant to dental care. We will recognize high-risk patient profiles and early signs of HPV-associated oropharyngeal cancers. We will discuss the role of dental professionals in screening, prevention, and patient education on HPV and vaccination. We will also identify strategies to incorporate routine examinations, protocols, and HPV-related communication into daily dental practices. And we will also explain why recommending gentle, non-irritating oral care products may benefit patients with mucosal sensitivity. This is a disclaimer here. This continuing education webinar is sponsored by H2 Ocean LLC. I serve as the Chief Scientific Officer for the company and currently have a financial relationship with the company. So let's begin. Uh, Human papillomavirus, or HPV, is now a major etiological factor in oropharyngeal squamous cell carcinoma. Many HPV positive squamous cell carcinoma arises in young, non-smoking, or you can say a very lightly smoking adults. Oral HPV infection is common, but only a subset of infection progresses into malignancy. Clinical dentists are strategically positioned to detect early signs and can counsel patients on prevention. To understand why this topic deserves dental professionals' attention, let's first look at why oral HPV has become such an important issue today. When we go about the prevalence, it is most commonly sexually transmitted infection in the US. When we consider the different types of HPV subtypes, over 100 types are there, and 40 can be transmitted through sexually. When we see the type of transmission, direct sexual contact to genital areas, mouth, and throat can be a very strong transmission factor. Oral sex is one of the leading factors for transmission of HPV. 10% of men and 3.6% of women get affected by HPV. And it will take, years for infection for oropharyngeal cancer to develop. So we as a dentist have a lot of window period to intervene in between and can help the patient down the road. This is a typical, a classical clinical outline of how oral HPV lesions occur in oral cavity. There will be a wart on the upper lip or papilloma on the ventral surface of the tongue, condyloma on the soft palate, or at the ventral surface of the tongue. Now, to appreciate the magnitude of this issue, let's look at how the epidemiology has changed over the time. Now, HPV-associated oropharyngeal cancers have increased dramatically over the last 2 decades. These cancers now exceed cervical cancer incidence in men in the US. So that's a very high number. When cancer rates are rising, it's important to separate infection prevalence from the disease risk. So let's look upon that factor. Now, when we look upon the global prevalence overview, or oral HPV prevalence is around 7% in adults. Prevalence increases with age as well as the risk behaviors and the nature of the person itself. HPV 16 is a small proportion of oral HPV infection, but can yield to highest malignant risk. Now, oral HPV infection is relatively common, but most infections resolve spontaneously. The clinical concerns lie in persistent high-risk infections and the subtypes of HPV that are very high in causing malignancies, such as HPV 16. To understand these risks better, we must review the transmission pathway. The primarily transmitted via oral sexual contact. Saliva exchange also plays a contributing role in transmission of HPV infection. Oral mucosal immunity also play a very critical role, and that's why microabrasions enable epithelial entry when we talk about oral sexual related transmission. And we will discuss in this presentation uh, ahead, like how oral mucosal immunity plays a key role in these transmissions. Non-sexual transmissions routes may be possible, but it's not so much in common. Now, this is a very interesting research paper published in 2012, where they mentioned that, the rate of oral HPV infection increases and it depends upon the number of sexual nature of an adult involved in that. For example, they have concluded that the rate and progression of HPV infection depends upon how early is the sexual debut, how many, types of multiple sexual partners are involved, and whether the nature of sex involved is oral, anal, and so on. So there's a lot of concerns that oral HPV is primarily associated with sexual transmission, and oral sexual contact is the number one leading way of its transmission. And there's a lot of scientific research and data that supports this evidence. But we have to also know that not all HPV infection behaves the same way. There are low risk HPV infections like HPV 6 and HPV 11 that cause benign papillomas. But particularly, there are high risk HPV infections such as HPV 16 and HPV 18 that are linked to malignancy. Now, HPV 16 in particular drives majority of cancer cases when we talk about, oropharyngeal cancers in general. And also, vaccines targeted high risk oncogenic strains. So, getting vaccinations at an early age will definitely help reduces the incidence of oral HPV infection. And there's a lot of scientific research and data. There's a study done by D'Souza et al. In 2007 that really mentioned those things in detail. Now, there's a natural course of HPV infection. Most infections clear within 1 or 2 years of exposures. So when there's an persistent infections that remains for longer duration of times, it drives malignant transformation. To understand persistent, we have to review the viral mechanism involved with HPV infection, that how this virology plays into the action of HPV transmission. Now, human papilloma virus infects the basal layer of oral epithelium through tiny breaks in the mucosal surface. In high-risk HPV types, the virus produces proteins called E6 and E7 that interfere with the body's natural cancer control mechanism. So our body has our natural defense to protect ourselves from cancer. And we have two kind of proteins that play a very critical role, you know, E6 and E7. And these two proteins, you know, plays a very high role when it decides whether the cancer is going to benign or malignant. So the E6 protein of HPV virus inactivates P53. So E6 reacts with P53, and P53 is a key protein that normally repairs the damaged DNA or triggers cell death. And the E7 protein produced by HPV infection disables the retinoblastoma protein. And retinoblastoma protein is what that regulates the normal cell division. So when these protective pathways are lost, the infected cell continues to divide despite genetic damage, with persistent infection over the time, and these unchecked cellular changes can progress to malignancies. So this is the reason the two proteins produced by HPV infection, E6 and E7, targeting P53 and retinoblastoma, consistently over a period of time can lead to malignant transformation of HPV infection. Now, there are certain factors, influencing persistence. Smoking decreases clearance likelihood, immunosuppression increases duration, oral microbiome play balance impact survival. So oral microbiome plays a very critical role in terms of pathogenicity, or you can say that impact of you know oral HPV infection, how it will progress further. Multiple sexual partner increases the reinfection risk. So again, sexual contact is a critical point when we talk about oral HPV, and men at least get infected 2 to 3 times more than women. Now, recognizing early signs becomes essential in HPV. So let's understand how this progression happens from infection to carcinoma. So there is a series of events that occurs that leads oral HPV infection to a carcinogenic condition. So after initial HPV infection, most cases clear spontaneously through the immune system without consequences, without any adverse effect. When high-risk HPV persists, viral activity causes gradual disruption of normal epithelial maturation, leading to dysplasia. So dysplasia refers to, abnormal, disorganized cell growth that is not yet cancer. So the persistent dysplasia increases genetic instability and cellular atypia over time. So if these changes continue unchecked, they may progress to invasive carcinoma. And this is the whole sequence of events that happen from infection to carcinoma. Now let's understand some of the clinical recognitions in the dental settings, how we can, play a great role as a dental professionals in order to mitigate these infections. Early clinical red flags to watch. I mean, this is one of the most important things we as a dental professionals can do to our patients to help them, diagnose this condition at a very, very early stage. And, we can somehow save the life of a lot of people. Uh, when we see the clinical, conditions, there are certain red flags while we are observing the oral cavity or the posterior of the oral cavity. When we see painless ulcers, unilateral tonsillar enlargement, or complaints of dysphagia should always prompt closer inspection during the dental examination. We as a dental professional should visually assess the posterior oral cavity, retracting the tongue to compare both the tonsillar regions for asymmetry. Any ulcer or mucosal changes that does not resolve within 2 weeks should be documented and reevaluated. Persistent or progression should trigger referral rather than continued observation. So if we see these painless, unilateral, or asymmetrical anatomical changes inside the oral cavity or at the posterior of the oral cavity, we should immediately refer to the physician or the ENT surgeon after 2 weeks of observation. And let's review the lesion appearance, how they appear clinically in the dental chair, in the patient. So when we look upon the lesion in general, there is a papillary or cauliflower-like surface texture. If you can see in this picture, there's a cauliflower-like surface of the texture of the lesion. The lesion may be pink or white nodular growth commonly seen. Pedunculated or sessile base is possible. Uh, Usually asymptomatic at a very early stage, and whether it's a benign or malignant, we have to go through a series of examination. HPV lesions may appear benign early and lack symptoms. We have to keep this in mind. Monitoring changes over time is critical. Distinguishing between benign from suspicious lesion is the key. Suspicious lesion changes in size, color, or firmness. Bleeding and induration increases further concern. Focus our shift to high-risk anatomical regions in the oropharyngeal area. So let's discuss what are the high-risk sites. So when we talk about the high-risk sites, tonsillar crypts and the base of the tongue are common origins. Posterior examination must be deliberate, in detail, and specifically in comparison to both the sides. Visualization techniques can be used to further enhance our clinical skills, and very basic tongue depressors and mirror improve posterior visibility. A subtle asymmetry is often the first sign, and extraoral examinations matters equally as compared to intraoral examination. When we talk about the lymph nodes, we can observe painless neck masses are commonly early signs. Persistent firm nodes required referral to physicians or ENT surgeon. But there are certain situations when we miss those lesions. And why? Because these lesions are often painless at early stage, so the patient cannot complain and does not mention anything about those lesions. They are located in deep posterior oropharynx area. So we as the dentist have to look beyond the oral cavity to get more access to those, high risk anatomic areas. Patient rarely self-report subtle changes because it is not possible for patient to distinguish so precisely at that very posterior region of the oral cavity or the oropharynx. And also, there is a screening inconsistency across various dental practices. So it depends upon some certain types of specialty, dental practices like orthodontics, endodontics. They just focus on the key focus area rather than looking in oral cavity and oropharynx as a whole. And that's why we have a varies of, reporting about HPV infections through dental professionals. Visual, adjuncts can help in uh, further making clinical decisions. And biopsy is the gold standard, definitely. And whenever there is an doubt is required, we can always refer it to ENT. And early escalation definitely improves the patient overall response outcomes, and screening must be routine in dental practices, especially to the oropharynx region. Now let's understand the screening workflow and documentation process of dealing with HPV related infection, diagnosis and monitoring. So why screening belongs in dentistry? Why we are now talking much about dentistry as a main pillar of recognizing this disease earlier than primary care physician? Because oral cavity examination is routine in dental care. So patients report much more to dental clinics than to their primary care physician in general. Most early HPV lesions are discovered unintentionally. So we have to be very careful in terms of, giving time to the patient, quality chair time to the patient. Dental hygienists are the keys, have the key opportunities to screen HPV infection. And I always proudly say that our dental hygienists are the backbone of dental profession. I mean, they are the ultimate people who have that kind of talent, that kind of time, and that kind of unique opportunity to help patients in order to, diagnose, monitor, and help them at a very early stage. So to all the dental hygienists who is attending this course, hats off to you, and you guys are doing really appreciable job. So, and I can say that within 60 seconds, a dental hygienist can able to diagnose an HPV infection case at a very early stage and can, save life of a person very easily. Now, there's a stepwise technique which can be used in order to visualize the examination process of HPV related infections. Start extraorally. Start, evaluating the patient extraorally, lymph nodes, neck asymmetry, and then move to the intraoral examination for HPV point of view. Palpation technique. Try to palpate the lymph nodes, the neck regions, and try to, get familiarized with any kind of asymmetry from both the sides. Then start with the posterior oropharyngeal visualization. Now, definitely tongue depressors and mouth mirror can be used during screening, but there are other visual screening aids as well. For example, there are tissue fluorescence devices like Wellscope that have, that highlight the changes in the tissue metabolism and vascularity that may not be obvious under white light. So they are useful for identifying areas that needed closer inspection or follow-up. There are certain devices like chemiluminescence systems, which can enhance the visualization of epithelial abnormalities after acetic acid rinse. And these can be helpful as an adjunct, but they have limited specificity. Toluidine blue staining is still used, that highlights the area of increased nuclear activity and can guide biopsy site selection if we are going to, screen the tissue for biopsy. And all these methods are used to further enhance our visualization. But please, the key point here to remember is that no device replaces a thorough visual physical examination, a thorough posterior oropharyngeal inspection, neck palpation, and good clinical judgment. So these tools only help guide the attention but cannot make the diagnosis. So we have to make sure that, we as a dental professional, especially the dental hygienist, their clinical skills, their palpation methods, and their overall clinical judgment can be a very critical for your, for your particular diagnosis of a disease. So when we talk about the best practices, I will say that documentation. Do the documentation if you are in doubt for any patient, and recall the patient after 2 weeks of time. Use clinical photography in monitoring. When you are in doubt, take a clinical picture of that lesion or anatomical area where you think there's a doubt, and then compare it after 2 weeks. There's a follow-up of interval strategy. Try to call patients after every 2 weeks. Uh, and also, if you need, you can take the help of an oral medicine specialist to rule out any differential diagnosis before you move to the next stage. And based on all these judgments, you can have your decision trees that can be a very critical aid in order to to make a decision whether the patient has to refer to ENT, and how it can be used for further moving forward in terms of making a diagnosis for HPV. Now, also I want to mention that patient communication, vaccination, and prevention. This is also very critical aspects which we as a dental professionals can play a very, very, very good role into that. Let's do understand that. So HPV vaccination prevents cancers most effectively before exposure. So we have to understood that. Then that's why it is mentioned that all the vaccination should be done before 15 years of age. And there are vaccines like 9-valent vaccine protects high risk oncotypes, and these vaccinations even can reduces the persistence of HPV 16 and 18 strains which are responsible for malignancy, and they are proven cancer prevention tools. And as always, recommendation should be followed by CDC. What CDC recommends, what are the changes they made. So definitely, I always, request and always recommend everyone in the healthcare systems to follow the CDC guidelines and what they are making any suggestions. So definitely, it should be considered. Uh, HPV vaccination prevents cancer most effectively before exposure, and dentists can reinforce this awareness very effectively. Also, I want to mention that communication is the key. How when a patient is sitting in a dental chair, how we communicate to the patient is a very critical in terms of making the person accept your thought process into their mindset. Use cancer prevention vaccine wording so that patient should feel more confident. Try to be short, confident recommendation. Always try to give facts with numbers to the patient so that they should not sense like you are pushing someone, and they should be a comparison like between a myth versus fact. Avoid when we are talking to parents, when we are talking to young patients, and definitely if they are under 18, when they are with their legal guardians, always try to avoid sexual transmitted infections, because we don't want to involve with any stigma when we are talking with an guide, with an parent or responsible guardian. Try to make the discussion calm and make it normalized. And definitely, cancer prevention framing, the way we frame the wordings improve acceptance rate, and brief confident discussions reduces the stigma, especially related to the sexual contact nature of this infection. Now, let's understand another aspects that as a dental professionals we have to take care of. What are the oral hygiene strategies and product selections when we talk about HPV patients? Now, there's a lot of research papers that have mentioned that poor oral health was an independent risk factor for oral HPV infection, irrespective of smoking and oral sexual practices. So we cannot rule out oral hygiene in total. So oral hygiene, oral health of a person, oral microbiome, oral mucosal immunity, all these two factors play a very critical role in terms of HPV infection transmission is concerned. Why oral care matters, in HPV patients? Because HPV lesions often occur on delicate mucosa. Uh, irritation irritation from the oral care products that contains chemical, alcohols, colors, preservatives, dyes can slow the healing process or worsen the symptoms. That's why we want patients and the people in general to use gentle oral care products that reduces these kind of discomforts and make the people encouraged towards using those products on a daily basis to build up the oral immunity. Focus on barrier protection plus moisture rather than just masking the oral cavity with flavors and um, a kind of fragrances to feel good. The role of the oral care product is to act as a barrier protection, balance the oral microbiome, and provides immunity to the oral mucosa. why, why are oral care products are regular oral care products which you see in the marketplaces are not the best choice? Because they cause more harm than benefits. Most of the oral care products contains colors, chemicals, alcohols, artificial flavors, synthetic fluoride, not natural fluoride, harsh preservatives, sodium lauryl sulfate in the toothpaste, and parabens. So all these things, all these chemicals, all these ingredients definitely worsen the oral mucosal immunity and increases the fragility of oral mucous membrane, delays the wound healing process. And that's why these components and these ingredients are very bad for the oral cavity. There's a lot of science behind that. Recently, the US government has, announced to pull back all the cosmetics, food, and other items that contains red 40. So red 40 is now a kind of an carcinogenic product, and it has been used in many oral care products since so many years. So you imagine a situation why you want to put a dye inside your oral cavity every day for no benefits, just to give all the bad effects, and that have a long term side effects, not only in the oral cavity but in the oral systemic health as a whole. So that's why it's very critical to understand the ingredients behind any oral care product. So there's a lot of studies, independent studies, published research data that mention that a lot of the oral care products contains numerous ingredients with the potential risk adverse effects, and that can have a serious effects in the oral cavity and the human body system as a whole. So this is another published research paper published in 2023. Uh, there's an independent research paper also published here that mentioned that oral microbiome plays a very critical role with HPV oral infection. So now, if oral microbiome plays a critical role in HPV transmission of infection, but here it is. There is a study that have mentioned that chlorhexidine mouthwash and oral microbiome. So when the oral HPV infection is influenced by oral microbiome, and why we want to take those kind of commercial chemical colorful alcohol based oral care products that can disturb this oral microbiome. So that's why we don't want the patients in general, whether they are HPV infectious or not. It's for everyone. One should avoid these kind of alcohol chemical based oral care products that always disturbs the oral microbiome, because it kills both the good bacteria as well as the bad bacteria inside the oral cavity. So if all the oral care products in the marketplaces is bad, so where is the solution? So recently, the solution has been referred as natural oral care products. So how well we are able to, bond ourselves towards nature, and how we can take the natural ingredients that can really help us to build our oral mucosal immunity as well as maintain a high level of oral hygiene without any adverse effects, without any side effects. And sea salt is one of the strongest scientific evident ingredient that has come to clinical picture. Now, why sea salt is safe and effective option? There are multiple reasons for that. Number one, it is gentle and safe formulation. Sea salt based oral care products are free from artificial colors, alcohols, chemicals, fluoride, synthetic fluoride. They have the natural fluoride within these ingredients, sugar, and preservatives, and ensuring that they are gentle and non-irritating to the oral tissues. They promotes healing. The natural minerals found in the sea salt supports tissue regeneration and wound healing, making it an effective choice for maintaining healthy and calm oral environments. Mineral-rich biological support. I mean, they contains a ton of minerals like potassium, sodium, calcium, zinc, gold, iron, and they plays a vital role in biological processes, enhancing the body's natural, repair mechanism during regeneration and healing process. They reduces the inflammation and swelling as well because of their hypotonic nature of the sea salt. They are naturally pH balanced. So the kind of pH required for remineralization of enamel definitely lies within the sea salt based solutions, and they are naturally antimicrobial in nature, and that inhibits the bacterial growth. And there's a lot of studies that has been published, a study published in 2008 that mentioned that antimicrobial and healing properties of sea salts in oral care, and that study has been published in International Journal of Dental Hygiene. So there's a lot of ways sea salt is boosting the oral mucosal immunity. Uh, so that's why, it also creates an environment that discourages the bacterial growth and promotes the healing of the oral tissue. So it works in both the ways in suppressing the growth of bacteria and pumping up and boosting up the growth of good bacteria, or what you can say that the natural probiotics inside your oral cavity without any side effects. So we have to be very precise in understanding. We have to use oral care products that can give the same amount of oral hygiene, good oral health, better oral systemic relationship, better oral microbiome, but without any side effects. Also, the sea salt plays a very key role in oral mucosal immunity. So, let me remind you the fundamentals of oral mucosal immunity. Oral mucosal immunity plays a critical role in preventing HPV persistence and progression. A healthy mucosal barrier limits viral entry and supports local immune surveillance through salivary enzymes, antibodies, and epithelial defense mechanisms. Disruption of the mucosa through inflammation, dryness, chemical irritations, alcohols, dyes, and colors can weaken this protective environment. And when the local immunity is compromised, HPV is more likely to persist in epithelial cells. So, supporting mucosal health, therefore, becomes an important preventive strategy in HPV related disease, and sea salt comes to a very strong candidate in order to boost this oral mucosal immunity. And that's why we say that natural ingredients play a very critical role in prevention of HPV infection. And there's a lot of independent, citations, website that mention that salt water helps in mouth ulcers. Salt gargling is it's been here for centuries, years before, even before any oral care company exists in the marketplace. So there's a lot of independent, what you can say that endorsements as well as recommendations from healthcare providers throughout the social media, through different websites, through different sources. And this is an interesting research paper that is published in 2018, and that they mentioned that how sea salt and rinsing with saline water promotes, growth of gingival fibroblast. So that means healing is promoted when we use the salt-based rinse. Another lot of research papers I can keep on pulling, so many research papers that established how it can prevent mouth rinse, helps in post operative recovery after dental surgery, and so on. But also we have to keep in mind that all salts are not equal. When we talk about the salt, these are the five key questions: which salt is the best, what is the mineral content of the salt, how is the salt harvested, how is the salt processed, and what is the purity level of the salt. So, to answer these questions, we have to understand that the sea salt from the Red Sea is a nature's best sea salt. And why it is the best sea salt in nature, the Red Sea salt, because it contains 82 plus minerals. The high mineral content is is found nowhere else near to even to the close in any kind of sea salt available in the marketplace, and that's why sea salt from the Red Sea is one of the best sea salt used for oral care and the skin care and the wound healing products. Also, there's an it is very important to understand why sea salt from the Red Sea is the best, because it is rightly balanced by the nature. There's an independent research paper published in 2016 that mentioned that the deficiency of trace elements and minerals like iodine, iron, zinc, and so forth has a profound effect on the body, and also if they are in excess. So we have to be very much sure that the mineral content should be rightly balanced. There are now research papers that establish these conditions to be well balanced. Minerals content is the key for success, and that's why these balance can only be achieved through a very healthy sea salt, such as sea salt from the Red Sea. And please be mindful that regular table salt is very weak and slow, and table salt is not sea salt. Sometimes people confuse salt rinse with the table salt rinse. Uh, so there's a lot of difference, between a table salt and a sea salt from the Red Sea. Table salt has the two mineral contents, sodium and chloride, whereas the sea salt from the Red Sea had 80 plus minerals. And the sea salt is evaporation and sun dried, organically harvested, and it aligns totally with the human saline system. And that's very, very important, and that's very, very critical when we talk about compatibility with the human body and the human healthcare system as a whole, till the cellular level. Even at the molecular level, these salts are very much compatible with the human health, and they are not produced commercially, and they don't have any environmental effect, as they mentioned with the sea salt from the table salt that is produced commercially in the marketplace. There's a lot of independent research studies that mention that how the sea salt has a lot of therapeutic properties, wound healing properties, anti-cancer effects. Head and neck cancer treatment induced mucosal toxicity can be reduced with sea salt rinse, and definitely dental caries as well. And there's a lot of research papers, I mean, with how, what are their indications, what are the studies. So we have a lot of scientific data, and it's not like anecdotally we are mentioning that sea salt is a proven. Nowadays, sea salt, a pure sea salt, a mineral rich sea salt, a naturally harvested sea salt, unrefined sea salt has all these potentials. Even the salt rinse recommendation, a regular salt rinse recommendation is now recommended by all the major hospitals and cancer research centers in the US, including Moffitt Center, Mayo Clinic, MD Anderson, the multiple oncology journals that mention that salt rinse has a potential effect in mitigating the oral side effects of even radiation therapy and chemotherapy. So it is one of the most, recommended oral care solution for building the mucosal immunity. There's a lot of research papers that support this scientific evidence of salt rinse and why sea salt from the Red Sea is the best. There's a lot of research papers that keep on, flourishing in the scientific databases. Another important aspect of one of the key ingredient in the oral care is xylitol. So xylitol definitely inhibits cardiogenic bacterial adhesion, promotes salivary function, and it's been in dental industry for so many years, proven, recommended by, accepted by ADA, and it reduced plaque biofilm activity. A lot of research has been done. But I also want to mention that xylitol supports oral mucosal health by reducing the pathogenic bacterial adhesion and promoting a healthier oral microbial balance. Xylitol stimulates salivary flow, which is important for maintaining mucosal hydration and local immune defense. A well hydrated, less inflamed mucosal surface may better support natural viral clearance mechanisms. While as xylitol does not treat HPV infection, neither prevent HPV infection, but maintaining optimal oral hygiene and mucosal integrity can definitely help reduce conditions that favor viral persistence. For patients at risk, xylitol containing products can be a gentle supportive adjunct in their daily oral care. So that's why xylitol is important for here to understand. One more ingredient I really want to mention, that lysozyme. So it is naturally lysozyme is naturally occurring antimicrobial enzyme found in saliva and other mucosal secretion in the human body. It supports oral mucosal immunity by breaking down bacterial cell walls and help regulate the oral microbial environment. A balanced microbiome and reduced bacterial burden can support healthier epithelial surfaces and local immune responses. While lysozyme does not directly treat or prevent HPV infection, but maintaining a protective mucosal environment may help limit the condition that allow viral persistence. Lysozyme containing oral care products can therefore serve as a gentle supportive component in comprehensive oral hygiene for at-risk patients as well as for general population in order to build up their oral mucosal immunity. So I conclude this like, if you look upon the three major natural ingredients that can be used for the oral hygiene is sea salt from the Red Sea that contains 82 plus minerals, lysozyme, a natural immunity plus has a lot of wound healing properties, as well as xylitol that has a great effect on oral microbiome, plus natural antibacterial in nature. And we are, a lot of scientific and research data supporting those evidences. So the key takeaways from this presentation, I will say that HPV lesions are often subtle, and screening routine during the dental examination is the key in order to prevent those kind of infections or in order to detect these kind of infections. Vaccination and awareness is also a cancer prevention that dental professionals can do. And always choose oral mucosal friendly oral care products that builds the oral mucosal immunity. Avoid chemical and alcohol in oral care products, and definitely dentistry can lead the prevention movement to a next level. And I again repeat my words, dental hygienists are the backbone of the dental professionals. So dental hygienists have a unique opportunity to save lives, and their job is beyond, cleaning and polishing. Their job is to save the life of the people by detecting HPV lesions at a very early stage. So thank you very much for what you do, guys. With this, I end my presentation, and I thank you everyone for being so attentive during this presentation. And I am here for answering your any questions you have. But if I miss certain questions, please reach out to me. You can write an email to me, and I will revert back to you in a couple of days or as early as possible. Or you are also free to, connect with me or the LinkedIn, and we can always mutually learn from each other. Thank you very much and have a good night.
Thank you very much, Dr. Saini. We have some questions. I want to remind everyone we're not done yet. We have 7 minutes left to go. So please type your questions into the chat area. Question, besides sun drying, how is the red sea salt sterilized or disinfected from the natural pollutants in the sea?
So the sea salt from the Red Sea is derived in a world eco-protected region. So there is no, allowance of human activity, beach activity. So it is maintained its pristinity at a very high level. And secondly, it is always unrefined, unprocessed, and sun-dried. In terms of processing through the product, it goes through a series of different stages of manufacturing processes that make it viable as well as, free from any kind of infection or any kind of pollutant at the time of manufacturing. So that's why we say that all the products that are manufactured in FDA approved facilities have all those kind of check marks done in order to maintain the quality of the products.
Is sea salt contraindicated in patients with hypertension?
No, I mean, as I mentioned in my presentation, the key here is balance. So, sea salt from the Red Sea in particular is well balanced, containing 82 plus minerals. It is not heavily packed with only two elements like sodium and chloride, as we see in the table salt. It is very well balanced in terms of different percentages of mineral content in it. And secondly, this is for oral care. We don't recommend someone to ingest or take portion of the mouthwash. But if they do accidentally, or they are safe, I mean it is safe to swallow, but it doesn't affect your hypertension level. And as far as my knowledge is concerned, I have not seen any adverse case reported to my knowledge of hypertension related complications by this mouthwash.
Can sea salt rinse be used daily?
Yes, 100%. And as I mentioned, the purpose of the sea salt rinse is to build the oral mucosal immunity. The whole baseline and the fundamentals of a sea salt based oral care product are two. Number one, there does not have any adverse effects, no side effects, no color, no alcohol, no chemical, no dyes, no furnaces, no preservatives. It is all natural. Secondly, it will not disturb the oral microbiome because it will not kill the good bacteria. And this is very critical. And we have seen during this presentation, there's a lot of research, lot of scientific data that mention that oral hygiene and oral microbiome level affects the HPV infections, including the oral mucosal immunity. So all these factors are well taken care by the sea salt from the Red Sea. And that's why we say that sea salt based oral care products will not prevent HPV infection, will not treat HPV infection. We don't make those claims, but definitely it will build up the immunity and definitely helps to fight against infection at the next level, which a regular oral care product will not able to achieve.
Dr. Saini, can you touch base again on using tools like Velscope to screen for HPV?
Yes, definitely. There are screening methods. Like, for example, Wellscope is a tissue fluorescence device, and it highlights changes in tissue metabolism and vascularity that may not be obvious under white light. So they can be useful for identifying areas that needed closer inspections or follow-up. But as I said, that these tissue fluorescence devices or chemiluminescence systems like Vislight, they can be used as an adjunctive aid for suspicious lesions, but they cannot replace an physical oral screening. So no device replaces a thorough visual examination, whether it's in posterior oropharyngeal inspection, neck palpation. A good clinical judgment is the number one tool, and definitely these all other are adjuncts that can help us better understand the situation at the uh, tissue level.
Has the HPV vaccine ever been known to have possibly caused seizures or death?
Well, it's a what I can say that it's a question for primary care physician in general. I will say I don't want to overstep my limitations here. Definitely, I will highly recommend getting a vaccination. It's an person's choice. We as in healthcare providers always recommend those vaccinations, but discussing it with your primary care physicians, the side effects, the advantages, and then you can weigh in what you think. As an if you are an adult, you can make your decision. If you are a parent or a legal guardian, then you can think about your that the little one, whether you want to get vaccinated or not. And definitely, I always recommend to follow the government and federal guidelines. What's going on? What is the schedule for vaccination? what is the regime, how many doses, and is there any change. So definitely go through your primary care physician, go through CDC websites and follow those pathways. We as the dental professionals has our duty to look those suspicious lesions, make ourselves, our patients awareness of a vaccination, a tool which is available. But we as the dental professionals are not here to give them recommendations of how many vaccination, dosages they should get, whether it's in one shot, two shot, three shot. It's all, it's a matter of healthcare, primary care physician, and that's what they have to discuss with them.
Thank you very much. So we have quite a few questions about sea salt and red sea salt. I would recommend we're going to post the code here momentarily. But if you'd like to learn more, stay on for a few minutes. Tap on that banner at the top of the screen. You can claim a free sample from H2 Ocean. That link is also in the chat area as well. I'll go ahead and post the code. And Dr. Saini, thank you very much. Stay on for more clinical questions here after the video.
Yeah.
All right, your passcode is 495183. 495183. And again, claim a free sample. You can tap on that banner at the top of the screen, fill out the information. I see quite a few of you are going to it right now. It's also in the chat area if you don't see the banner on your phone. $495,183. We're going to put it in the chat area as well, and hope that you'll stay on and learn more about red sea salt from Eddie Kolos. Passcode in the chat area. Okay, we are going to bring up Eddie's video, and then he's available for questions and answers here around the product. So some of these remaining questions that we have are very product specific. We'll have the expert in addition to the other expert here follow up with those questions. Have a question about claiming a free sample, please tap on that blue banner at the top of the screen. And we're bringing up the video right now. Sorry, it took an extra second here to load. So just one moment, please. It's loading. There we go. Thank you all for staying on. If you don't have the blue banner, Jody will repost the link for you.
Hi, I'm Eddie Kolos, the CEO and inventor of the first ever sea salt healthcare products. Today, I'm excited to introduce to you H2 Ocean, a global leader of sea salt healthcare products since 2001, pioneering the use of sea salt-based products in healthcare. Over the years, we have developed more than 32 products across various categories, distributed both in the US and internationally. Our commitment to excellence has earned us awards for Entrepreneur of the Year and globally recognized. We are not just about business, but we're also deeply committed to ocean conservation. At the heart of every H2 Ocean product is sea salt from the Red Sea, known as the world's most mineral-rich sea salt. This hand-harvested, unrefined sea salt contains over 82 trace minerals naturally aligned with the human saline system. This unique composition is what sets us apart from all the other products. We uphold the highest standard in quality in our production. Our products are patented, cruelty-free, and manufactured in an FDA-registered facility. We are committed to continuous innovation and development, ensuring that we stay at the forefront of sea salt healthcare. Now, let's focus on one of our flagship products here, the H2 Ocean Healing Rinse, the world's first sea salt-based mouthwash. What makes this so special? The key ingredients: red sea salt, enriched with 82 trace minerals, hand-harvested, unrefined, and perfectly matching the human body saline system. Lysozyme, an antibacterial enzyme that enhances immune system's protective function. Xylitol, a natural sweetener, approved by the FDA and widely accepted in the dental industry for its oral health benefits. Our sea salt mouthwash offers excellent results in various oral health issues, including dry mouth, bad breath, post-extraction care, implant hygiene, and daily oral care. It is safe for all ages, including diabetics, and contains no alcohols or dyes, or any harsh preservatives like fluoride or added sugars. It's scientifically backing. H2 Ocean's mouthwash isn't just a product, it's a scientifically proven solution. We conducted extensive studies on its effectiveness in treating gingivitis, dry mouth, dental caries, and for orthodontic hygiene. These studies have been published in reputable scientific journals. H2 Ocean has become the #1 post-dental care mouthwash for surgery, orthodontics, and implants. We offer excellent patient compliance with our cleaning with healing approach. Our product comes in 2 natural flavors, the Arctic Ocean Mint and the Lemon Ice, in 3 different sizes to suit your various needs: the 64 ounce, the 16 ounce, and the 8 ounce. For dental professionals partnering with H2 Ocean, we offer both clinical success and financial growth. We have 2 main partnership programs. A wholesale partnership. This program offers significant discounts, allowing partners to generate additional revenue. For example, our 8-ounce mouthwash bottles, we have a manufactured suggested retail price of $10, but they are available for our partners for just $5, offering a 50% profit margin. The affiliate program. This is a flexible, zero-commitment program that allows partners to earn without any overhead costs or inventory hassles. It's a simple 4-step process to get started, and partners can potentially earn a minimum additional income of $13,000 annually, based on referring 100 new patients each month. H2 Ocean is more than just a product. It's a revolution in oral care. Our sea salt-based mouthwash offers unparalleled benefits backed by scientific research and trusted by customers and industry partners alike. We invite you to explore partnership opportunities with H2 Ocean. Whether you're interested in the wholesale program or an affiliate program, we're here to support your success. Thank you for your time today. If you have any questions, please don't hesitate to contact us at info@h2ocean.com or call us at 772-219-8183. Together we can transform oral health care with the powers of sea salt. Thank you and enjoy. Hello, everybody. Someone has a muted microphone. Is it mine?
I'm listening you, Eddie. I'm getting your voice.
Oh, okay.
Hi, Dr. Rawlings. Are you still here?
She paused, maybe. There's a lot of people on tonight. She'll get it up here in a little bit. I'm logging out and logging back in. All right. Hello. They'll send you a code again.
How is that? Are you able to hear me now?
Yes, we
Yes,
can.
we can.
I don't
Yeah.
know what happened, but nobody could hear me.
Yeah.
I want to remind everyone at the top of the screen, tap on that banner and claim a free sample. You can learn about the affiliate programs with H2 Ocean as well. Learn how you can get these products in your office. Pricing on these are tremendous. And patients are not going to break the bank with H2 Ocean. It's a great product to get in their hands at a very affordable price. In your course folder, you're going to see the exact copy of Eddie's presentation here. Take it back to your practices. All right. If you're looking for the quiz, please scroll up or look in your course folder. All right, so we have quite a few questions that are product related here. Let's go up to the top, please. Here we go. The rinse comes in lemon ice and Arctic Ocean mint flavors, but I have some patients who have undergone radiation in their oral cavity, and those types of flavors burn them. Has this product been used by patients that have those kinds of sensitivities have been found not to cause any pain or discomfort? Eddie, let me jump in on that one. Many of you know I had a C. diff infection, and I had to take oral vancomycin for months and months and months. And I was left with sort of a form of oral mucositis and a lichen planus. And I've used these products myself. These are very subtle flavors, and I can't normally use mint. And these products, I don't think are going to be an issue at all with your patients that otherwise couldn't use them. But okay, Eddie, now you're able to talk.
Well, we don't use any harsh
Right.
chemicals in our products. Very clean and very minimal amount of ingredients. So we look into anything that might cause allergic reactions. We don't want anybody to have reactions. So we look to minimize any kind of effects that you might have on some of these patients. Of course, we are doing research now with a lot of chemo radiation patients. That's a dear thing in my heart that I want to help out, because I've had a brother that also went through, my younger brother, through chemo. My best friends and two of my best friends and my brother are survivors because we took a natural route, but we also used, they used the chemo radiation and used these products while they were going through that.
They're very mild,
Mhm.
very refreshing and healing. Okay, question here. What about for use in irrigation, like a water picker, water flosser?
Yes, that would be possible because the diluted salts and all the ingredients don't have any kind of mineral content that settles. There doesn't need to be any kind of shaking to the bottle or anything like
Yeah.
that. So
And
it
yeah,
flows
and
easily
also,
through
yeah,
those micron
yeah,
little.
there will be absolutely no clogging. So definitely, you will your oral irrigator system will work well. We believe if it is of good quality, and these products will not, do any bad effects to those, but definitely will help in your getting periodontal pockets and deep interdental areas cleaned with those irrigators with the right amount of oral care product.
Can you identify again sort of the differences why Himalayan salt would not be preferable in this situation and how your product is more efficacious?
Well, Himalayan salt comes from the mountains of the Himalayas, which it actually is on one side of India and the other side of China. And once the United States went crazy in the food marketplace for the Himalayan salt, they have been cutting that mountain up with heavy machinery, which leaves back all those contaminations that you don't see, like the heavy metals. Every metal machine used around salt, if it's not used with a 3/16 L type stainless steel, it will rust and it will contaminate the salt. So they have high amounts of iron, rust, metals, and they're contaminated. I do not like to use that. I always tell a lot of my friends and family and other physicians that it's not the way to go. Himalayan salt is something that is not in my household and will not be because of that.
Eddie, what is the lysozyme derived from?
The lysozyme, you can get it from pretty much anywhere. Ours is from the chicken egg white, but it's from the very top one manufacturer that I found over 20 years ago when there was only one available. So they have the most research on lysozyme than any other company out there because it became pretty big in scientific discoveries in the medical field. There is now multiple ones. There's things that you can get from different plants, vegetables, but we've tried them. They have always been, very aggressive to give me a sample to see if I would switch. I don't switch my ingredients. I truly believe in the ones that are the best out there that have the longest studies available on our ingredients. So that's where it's derived from, and it's from one of the best companies out there in the world.
And also, Dr. Rawlings, I will add to Eddie's comment, like lysozyme, depending upon its amino acid structure. Eddie is very familiar with that. Yes. So, how much there are 3 different types of lysozyme: C type, G type, and I type. So C type lysozyme has amino acid 129, and human body has 130. So this is the closest and the most precise lysozyme you can get it, which we are using in our products, and that's why we are using amino C type of lysozyme. That is the best, and it matches the most to the human healthcare system.
Very good, but we're giving out trade secrets now.
That's okay. Well, we'll cut that part out of the recording.
No, it's very fine. It's okay. It's the most expensive anyway, so it's not easy to get.
All right. How do you suggest we make these recommendation switches after recommending over-the-counter toothpaste and rinses?
Well, with no period of time, maybe another matter of couple of months, you will be having a sea salt based toothpaste as well, and that can complement each other very strongly, and synergistically they can work in the oral care, oral systemic health care as a whole. And definitely, I believe in the next CE program or 100% by February CE program, we can offer to our attendees a sample of the toothpaste, a sea salt based toothpaste as well. So, then they don't have to worry about which toothpaste company they should use when they are using our sea salt based mouthwash. So just a little bit more weight. And this weight is prolonging because Eddie is very, stringent about the quality of the products. We don't want to rush anything forward in order to make some, profits out of the product. So it's the quality which is keeping us little behind for the product launch, right, Eddie?
That was 3 years in the making. We've had all our studies done, and everything is been approved, filling process is going to be coming here in about a week or two. So yes, we're really excited about that.
Should dental treatment be postponed so as not to disturb an area of concern?
For what?
I think we're talking back oral HPV. If you have an
No,
area that
no, I don't think so. Dental treatment can be postponed, but definitely you have a different kind of safeguarding protocols and different kind of, operating disinfectants after doing all the uh, emergency dental procedures. But simple dental procedures which doesn't require any emergency treatment or immediate attention can be little bit of postponed till we get a confirmation about HPV diagnosis from a primary care physician. And then we can, based on the protocols referred to us, we can definitely keep on, treating the patient based on their needs.
is there any difference from getting red sea salt from Amazon versus H2 Ocean?
So, I mean, Eddie can speak on this.
Yes, there is a difference because the other Red Sea salt company, and there's only two of them out there, has a higher amount of iron in it. It's not like the same. Ours is pretty much unrefined sea salt dried in the sun. So there's only a certain amount that they make. So they're not really accepting any more distributors. I'm thinking about making more products with it too as well. We bought it up even after the Red Sea and simoleons were going after the ships. So we have plenty of it. We won't run out. But there's only two of them that are coming out of the Red Sea right now, and we have one. And we're not going to say the actual distributor that we get it from, but I don't believe it's from Amazon. We don't buy from Amazon. We actually have to buy direct, as we are distributors of that too.
There's a question here. How familiar are you with the effectiveness of antivirals like resveratrol as studied by the NIH for prevention of viral spread?
Well, during COVID time, especially, there are a couple of studies that have been done, not related specifically to our products about H2 Ocean, but there's a lot of studies that have been done that where the saline rinses, saline nasal sprays are preventing a viral infection. So definitely over the period of time, we can always provide strong scientific evidence. And we have to understand the fundamentals of all those studies rather than, focusing on the primary outcome of the study. So these products are naturally aligned with the human system. So we are repeating this again and again, and it sounds sometimes, redundancy that we are repeating those things. But when you are aligned very closely to the human immune system, you are building the immune system. You are building the capacity of the human body to fight against the bacteria, viruses, as well as different infections naturally rather than relying on the antibiotics or other kind of systemic, drugs, which we are trying to achieve in order to build those immunities. So as we can say an analogy, we take vitamins and multiple supplements every day, almost, especially in the US market. So it is like supplementing your oral cavity with the right amount of the minerals, enzymes, and salt that can not only build the oral hygiene, but also build that kind of immune support system to fight against those infections and viruses. So definitely the answer is yes.
But also, just like in your study, one of your studies you pulled up, too much of a mineral content, even like from
Yes.
the vitamins, can be toxic to the body and to the cells
Yes.
itself, and especially cells that are just now trying to rebuild themselves. And with the right amount, which the Red Sea salt provides, the trace minerals to a 0.001, even at that level, is beneficial because it's not too deficient and it's not too toxic where it would be too high in the mineral content. So we're building super cells when you're using the right types of sea salt and everything. And some of the manufacturers out there too, they're really quick to manufacture something that is hot in the marketplace. So they're going to put whatever they want to put in there, and they're not going to do the study work that we have done on our products that we put in our ingredients in our products.
Can you comment on red sea salt and tonsil stones? I see a lot of this on TikTok with H2 Ocean. So
Absolutely. They work very effective on tonsil stones, and that's something that got viral because a lot of young people are having those problems. So they seem like after using it even quickly, just like a canker sore will heal up super fast, they feel like they get rid of them within a couple of days. They can use this rinse more than just once or twice a day. It's not going to affect them and make them feel like they are mineralizing or too much of something, because the body is going to use it as a sponge, use the minerals that it needs, and then it's going to get rid of all the others. But with the lysozyme and the xylitol there's in there, even the little bit of menthol in there, those are all active ingredients too as well that work really, really well with the red sea salt.
thank you. Any other questions? What ages, Eddie, can use the product?
Oh, we've had babies drink the whole bottle before, when it was getting really nervous when that happened to me after, having my company and developing this product. After the first year, I had a mother call me. Nothing happened to the baby. But we have so many people that start their kids off very early and they love it. There is 2 different flavors. We have about a 50-50 on when we did the taste tests. And we have my graphic designer who has twins. I have twins too as well, who just told me today that one of his twins likes the lemon, the other one likes the Arctic. So he has to buy 2 different ones. So and also he likes the lemon and his wife likes the Arctic. So it's a 50-50 all the way across the board. And I always suggest try both, because if somebody says, oh, I hate that taste, it's just their preference. They're going to work the same, but we know that even the lemon is a little bit more powerful, even when you're sick or you have a sore throat, just from the studies that we did, right, Dr. Rajiv?
Yes, 100%.
We have up on the screen the flavors right now in the different sizes. So for those of you with your practice and you would like your patients to be able to use a pre-operative rinse, etc., post-operative rinse, you can use the large 64 ounce with the pump, and then you can distribute the smaller bottles to your patients. Any other questions?
I'm seeing someone is posting for tonsil stone. Do you want to swish with it or gargle? So I will definitely say that gargling is definitely will help in certain way, followed by gentle swish that can, to remove all those debris and attached irritants from the oral cavity.
Yeah, I mean, they can gargle, they can swish even vigorously too as well. I mean, it's not going to damage anything. It's to remove those tonsil stones. So I don't see it causing any irritation. It would actually revive the cells and keep them from coming back too as well if they're using it daily.
Do you have other products available, like nasal saline rinse or something?
Yes, we do. We have, that's why it's called H2 Ocean. We have a whole line. We even have hair care products for regrowing hair that's coming out soon too as well. But post surgeries, first aid sprays. The first aid spray is amazing. Insect bites. I mean, you could put it on a mosquito bite, gets rid of the itching, the irritation, and within probably less than a minute. So it's something great to bring on a camping trip or any kind of vacation where you might think that, you're getting bug bites or a wound that could happen. Very good irrigation, but also, infection protection, cleaning out the wounds itself. Nasal spray is great. We're really low on the nasal spray right now because the FDA had put some warnings out there for all the other nasal sprays that are on the market because their manufacturers were dirty water and caused bacteria in their products. So there was a big recall. We have a bag in the can system. We started that about 20 years ago. And that bag in the can system doesn't allow air or contaminants back into our product, so they remain sterile. We have tests like the mouthwash has a 3-year shelf life. It says it right there. Most products out there only go for a 2-year shelf life because their microbiology in their antibacterial properties are not as strong to actually keep the product from growing bacteria after 2 years, or they just don't have their formulation right.
Okay. Any other questions? Well, Eddie and Dr. Saini, anything you'd like to say in closing?
I would like to say that, let give yourself a try to H2 Ocean, and definitely you will not be surprised to see the good results which you and your patients can get after recommending that product. And especially for the dental professionals, it will really enhance the compliance factor for the patients, and that will bring a very strong outcome of your clinical work which you are doing for your patients, and definitely it can bring a lot of business to your dental practice. And considering nowadays so much of challenging cases in the clinical dentistry we are seeing, and in this world of social media, so it's better to to guide your patients with the right kind of oral care products so that the outcome is beneficial to the patient and they can appreciate the dentistry that you are doing to the patient. Thank you.
We also have ongoing studies, so stay tuned. If you have any other recommended studies that you want to see with our products, you can reach out to Dr. Rajiv. He would be happy to talk to you about those and send you any of the clinical studies that if you want to read on them. And we really appreciate doing this for the dental community, but also the people out there that are in the need of something like this that we knew was going to happen, where the dyes and the alcohols and the chemicals, people are now going away from those and looking for an alternative that has truly helped people in their needs of their oral care and health care. Health is wellness.
Well, I want to thank you both so much this evening and sharing your knowledge with us. And we'd like to also thank H2 Ocean for supporting this program. And we do want to remind everyone, if you go to the website under About, you'll see Dr. Saini's other courses that he presents in the schedule. So check those out. And I guess we're going to have to check out and tell everyone good night. So thank you again for being here.
Thank you. Good night.
Thank you.
Good night now.
Thank you. Good night.
Thanks for having
Bye.
us. Bye.